So today we're talking about blood system disorder, purpura. So purpura may be caused by different reasons. We're talking especially kind of purpura. So that's the ITP here. So firstly, let's talk about what is ITP. What it means? So ITP basically relationship. People have bleeding problems from the purpura, like mainly under the skin, some blister in there. It relationship with the immunity systems. Belong to an autoimmunity disorder and cause bleeding. They also relationship with the spleen. So that's basically. These illness maybe happens in children, like teenagers. So that's typically is acute one. But they can limit it itself. Like basically, it's not that severe kind of disorder. So that's something attacking like immunity systems, like by the virus attacking relationship and the relationship with the platelets. We know platelets, it functions, it stop bleeding. So in children, some platelets disorder and then cause bleeding. If it happens in the adults, this illness usually is chronic process. And that's we're talking about general relationship with immunity disorder, autoimmunity functions, and against still flatline. So that's basically for the adults. And for autoimmunity system disorder, not only have ITP, we have some other autoimmunity disorder. Generally speaking, they will be happens more in the woman comparison. The reasons not that totally clear yet, but maybe relationship with hormones. So that's the general picture we're talking about ITP here. So this basically we say that's anti-immunity disorder. Anti-immunities, their antibodies, especially against platelets, and then cause the platelets level is decreased, and the people easily bleeding, cause different kind of bleeding problems. That's mainly. So how is the medicine diagnosis for this illness? So basically, this illness causes the mainly problems is the bleeding problems. So people have some bleeding spots on the mainly happens under the skin and the mucosa. So that's basically the first symptom is the patient have bleeding. Maybe small amount, maybe big amount. So that's to see how severe of the illness. And in the adults, the spleen is getting bigger. So I use for kind of blood cells. They will go to spleen, destroy it. In this kind of condition, spleen gets bigger and destroys most used blood cell also. So generally speaking, the bone marrow is normal. Like they are not truly increase more normal cells in there, but just the destroyed part is getting excited. So in acute type, if we test blood, so basically finding for platelets is decreased and pretty fast decrease when it happens. And the platelet's lifetime is much shorter than normal. So that's the illness mainly relationship with the platelet number decrease. Platelets mainly function stop bleeding because platelets number decrease sharply, then cause the people have bleeding problems. So clinically, we can see patients have bleeding problems and go to blood tests to find platelets number is decreased. Go to checking like ultrasound or maybe CT scan to checking patient's spleen is getting bigger. And what's the treatment for this illness? So usually for what's the treatment for the adults, maybe use some orally use some medication, some hormones, yeah, cortisol belong to adrenal gland kind of hormone. So that's truly can reducing acute inflammation. So that's basically can working for some patients. And after the use the medications, 2 to 6 weeks, their platelet number will go to normal. So that's for most people. That's for most people. For some people, but most patients, yeah, but most patients maybe don't have that kind of response very soon. And so that's basically in this kind of case, if people not working with cortisol, so that's maybe need remove surgery, remove spleen. That's maybe working. So that's basically, and also platelet transplant. If patient continually low level kind of platelets, need blood transplant and stop bleeding. But we still try to treat original problems there. Otherwise, the situation still will be happen. So that's provides the medicine treatment for this illness. Then we're talking about the TCM aspect. So TCM aspect truly belong to bleeding problems. 血 is blood. 症 is syndrome. Bleeding condition. So that's just the explanation for Chinese here. And the 鸡血 still blood. So spontaneous bleeding. Yes, spontaneous bleeding. And also we maybe have some other name for these problems. Generally say just belong like the symptoms there. So that's basically. But generally say relationship with the blood disorder and mainly bleeding disorder. And for the TCM etiology, how the illness happens. That's still possible, maybe coming from external, some passenger evading, maybe from some internal, like emotions, cause, and maybe something relationship with the eating and the drinking, or maybe touching the toxins, fatigue, so or maybe other illness and aging. For everybody different condition, they may be coming from different results. Then we're moving to the different pattern and talking about the different pattern, how we can treat this kind of disorder. Firstly, we're talking about generally heat toxin. So generally heat toxins, the pattern mainly symptoms is acute onset. Heat inside, people thirsty, and dry mouth, dry throat, and maybe irritability, emotions, frustration, restless. Could be have red urination. We're talking about this illness is bleeding disorder. The possible bleeding from the urine. And the patient have heat inside, constipation, and a lot of dark color kind of purpura. So that's purpura is bleeding on the skin mainly. Under the skin tissue, under the skin tissue. You can see like a blister, like a blister. You can see the blister through the skin, but not truly blood coming out. And the patient losing blood may cause dizziness. And the other part also possible bleeding also, like bleeding from the nose, bleeding from the gums, and maybe bleeding from the urine, we talked about already, and bleeding from the stool. So that's possible. And even some people vomiting with bleeding. And in the female, menstruation, more blood coming out. So pretty big bleeding there. Generally say the blood is flashing red color. If we look in patient's tongue, so some flashing red tongue, 发性外汤 let be pupil color, yeah, 发性外汤 let be pupil, and dry yellow kind of tongue coating, or maybe let it be darker brown kind of coating. The pulse, very pulse and rapid. So that's for these heat toxin patterns. So in children, we know, so in children, sometimes they are not felt pulse. Children under 3 years old, we can look in the finger vein inside the pulse. So for the finger vein, we look in index fingers. There are 3 lines here for index fingers. The first line here we call vein or vein gate. Second line here, T gate. Third line here is the life. So basically the finger vein will come in from this side, gradually go to this side. If they just passing the vein gate here, that's usually EPI condition. If the vein passing the T gate here, it's internal disorder. If the vein passing the left gate here, that's pretty severe kind of disorder. So generally speaking, for the children, they are like the vein. They only passing the wind and the qi. So that's basically is not that severe, but still some special kind of condition may be even more severe. In that condition, they may pass in the life. So this pattern, yeah, generally say is acute condition, and then cause purpura. So that's basically is heat toxin pattern. Treatment principle: clear heat, remove toxins, and cooling blood, stop bleeding. Basically, we will talking about patient have bleeding disorder caused by heat. That means heat go to blood level. So that's why we need cooling blood. The formula we use 犀角 that's the herb's name. 地黄丸 we talked about before. This kind of kidney tonified formula and modified 加减。犀角 right now, 犀角 is the horse of the animals. There's a pretty special, I don't know what's the English name for 犀牛. It's special kind of corn. They have the horse. But right now, this kind of animal is don't have that big amount anymore. So illegally to use 犀角 right now. But we use 水牛角 instead. Because the formula name coming from the ancient time. We didn't changing the formula name, but 畜类 we are not use 犀角 anymore. We use 水牛角。水牛 水 is the water, 牛 is corn. That kind of corn usually in the water. They still cooling natural. So that's we use the whole of coming from the corn instead of 犀角, but we increase the dose. Still not that powerful, but truly is working. So 定黄汤 地黄汤 it's not 地黄丸 here. So that's basically we still have 生地 here. That's we talking about 犀角地黄汤. But we have a lot of herbs, cooling blood, stop bleeding here. Like 小蓟, stop bleeding herbs. And 紫草 can stop bleeding. 赤芍丹皮 is cooling blood. 玄参 can cooling blood also. 连翘 clear heat toxin. So that's basically talking about use for this kind of condition. Acupuncture. So this kind of condition, we are not necessarily use massage because that's a heat condition. But for Chinese, when we're talking about acupuncture, we always we put acupuncture and mouse button together. That's 针灸. That's basically we put together as a treatment method name, but not for this pattern for massage because of heat in it. So acupuncture, blood 17, splinter, moving blood, stop bleeding, working for blood disorder and cooling blood. Spleen 6, nursing in. Patient have a lot of heat inside. We need nursing in. And the kidney 1 also can nursing in. And also we think about this disorder, especially for children, may relationship with kidney disorder. So that's for acupuncture treatment. And the acupuncture, the points by different kind of conditions, we can add in more. Yeah. So basically, people have like a bleeding from the vomiting, we can add in lung 6 there, and the bleeding from the gums, we can add in the LI4 there, and same situation, bleeding from the stool from the intestine, we can add in stomach 37. That's the lower He of the large intestine. So bleeding from the stool, that's the He in the large intestine. So we add in stomach 37. And the urination bleeding, we can go to Ren 3. And so generally say for different kind of conditions, we can go to different points. Yeah, so this part you can look in yourself. So basically, we can modify the formula for different kind of conditions. 触类 patient very weak fatigue. We can add in stomach 36 for T tonic. So that we can modify for all formula. Then we're talking about Another pattern, because in deficiency heat rising up, then cause the bleeding. So in this kind of situation, generally say it's chronic problem. And the purpura on the skin. We're talking about the purpura is the worst. We're talking about some bleeding under the skin, but we can see some bleeding spots through the skin. So that kind of bleeding sometimes worse, sometimes light. And the color, maybe red color or maybe dark red color. And the plus bleeding everywhere, possible from the nose, from the gums, from stool, from urination. And the patient still have heat inside, irritability, and especially 5 central heat, and low degree kind of fever, usually in the afternoon or in the night, and also night sweating. So generally in deficiency symptoms and generally weaker. Patient also more dry because heat damage body fluid, dry throat, even dry tongue, and also can cause patient dizziness and tinnitus, and a big amount of menstruation. And also possible trembling. Patient also possible have lower back pain and weakness on the lower back and the knee joints under the knee. So generally say in deficiency pattern, mainly relationship with skin. So patient may have skin symptoms there. The tongue is red tongue, generally say without coating, held tongue, or maybe just little bit coating there. The pulse is thinner and rapid. So that's our pattern in deficiency cause the bleeding problem. So that's usually happens in chronic kind of purpura. That's pretty possible it follow acute condition, long term not cured, and then changing to chronic one. Treatment principle, nursing in clear heat. We still need cooling blood and stop bleeding. So the formula we use, 大补阴丸，大 is bigger, 补 is tonify, bigger tonify in formula. So in this formula, we put 生地熟地 together. 熟地 more tonify, 生地 more clear heat. And 龟板 in tonify formula, 旱莲草 in tonify, 知母 clear heat, especially deficiency heat. And 女贞子 kidney tonify, in tonify. 黄白 still clear heat, 阿胶 nursing in. 牡丹皮 cooling blood, 地骨皮 clear deficiency kind of heat, and 彻百叶 stop bleeding. So that's the modified 大补阴丸 used for in deficiency caused bleeding problem. Acupuncture, we still use bladder 17. You still can add in spleen 10 there, pulling blood, stop bleeding. And go to kidney tonified, bladder 23, back to kidney, and in tonified spleen 6, and also kidney back, similar like last pattern. And still can modified from there. Yeah, still can modified from there. Severe kind of purpura means severe kind of bleeding. Basically, like we say, we can add in generally add in spleen 10 in there, but if we talk about severe kind of purpura, adding spleen 10. And then for different part of bleeding, we go to special points. Pretty similar we talked about before. Yeah. And the big menstruations, we can go to liver 6, liver channel, go to genital area. And also you can think about spleen 1. Spleen 1, spleen T holding the blood, holding blood vessels. So you can add in spleen 1 to help stop bleeding. If patient have long-term fever, can add in 214. If patients constipation, can add in 3.6. Fatigue, stomach 36, and the back of the spleen, bladder 20. And dry, yeah, dry mouth, dry eyes, dry skin, dry stool even, can add in kidney 6. Indifferency pretty easily cause the yang rising. So if liver yang rising, we can add in liver 3 and gallbladder 20. And for spleen, like a big spleen there, we can go to liver 13. But be careful when you need liver 13 in this kind of conditions, because liver 13 pretty close to spleen location, especially when spleen getting bigger. On the left side, we'll need liver 13, not too deeper, and put the needle downwards, not upwards, shallow and downward, in case damage the spleen. So that's generally say in upper abdominal area, left side, be careful spleen. Right side, be careful the liver. These two organs pretty easily be damaged by the needles. So that's basically we need to be careful if we needle them. Then we're talking about patterns, spleen T dysfunctions and deficiency. Spleen truly for TCM, we're talking about, they have holding blood vessels, preventing bleeding functions. When spleen T deficiency couldn't holding the blood, it will be cause the bleeding problem. So that's generally say people fatigue, maybe poor appetite, losing stool, and generally weaker, and possible dizziness, short breath, and then have the bleeding disorder. like a purpura, and maybe bleeding from the gums, from vomiting, from cough, or even your bleeding, and maybe stool bleeding, is blood bleeding problems, and a big amount of menstruation, but the color is pale color like a pink color, less red color. So that's generally say for spleen T deficiency pattern is spleen T deficiency disorder plus bleeding. Tongue usually is pale color and with teeth mark on the side. Because spleen T deficiency, spleen T and T not working, so water retention. So that's pretty common problem. And weaker pulse. So these patterns generally say still belong to chronic pattern. So we say generally say excessive pattern belong to acute pattern. Deficiency pattern generally say belong to chronic pattern. It's a long-term problem. The treatment principle for this one truly we need tonified spleen and tonified T. And we say lending blood back to the flow means stop bleeding. Now blood go outside of the channel. That's the bleeding problem. We just lending it back. So these conditions we use 归脾汤 plus. 归脾汤 is the special formula. Spleen T tonified. We plus some herbs, stop bleeding. 归脾汤 nothing specially stop bleeding. So that's why we need adding there. So 黄芪党参 spleen tonified, 白术 spleen tonified, 汉莲草 can have some stop bleeding function, and 茯苓 spleen tonified, 当归 blood tonified, 白芍 blood tonified, 龙眼肉 calming 神, 阿胶 blood tonified. It's pretty good herb. That's coming from donkey's skin. So that's pretty good nourishing for the blood. And 炙甘草 T tonified harmonized formula. 大枣 T tonified harmonized formula. 畜类 we can adding more herbs here to try to stop bleeding. To see patient have what kind of bleeding. If bleeding in the urine, 白茅根 is a good one. And other kind of bleeding, you can add in like 彻百叶, 鳕鱼炭. So we have lot of herbs can stop bleeding. So acupuncture points, back of the spleen, and blood points, confident points, influence points of the blood are 17. And the 三阴交 3 meeting points, and the stomach 36 Qi tonified points. So that's for acupuncture. and can still modify it from there. So basically, pretty similar we talked about before. We have spleen 10, we have lung 6, we have LF4, we have stomach 37, especially for people stool with bleeding, and urine bleeding rin 3. So we have a lot of here. Basically multiplication part will be pretty similar. So kidney yang deficiency cause that's we got factor of the kidney and the Mingwen. And the patient have low appetite. We can go to stomach 21. And the spleen bigger, you go to liver 13. So that's basically the same. Basically the same modification. Then we go to the pattern, blood stasis cause bleeding. So bleeding for TCM pattern, generally say heat can cause. Heat including excessive heat and deficiency heat. Spleen Qi deficiency can cause bleeding. Now we're talking about blood stasis can cause bleeding. Blood stasis causes bleeding. Basically, blood circulation in the blood vessels, if some degree kind of blocking here, blood couldn't moving smoothly passing through. Then they moving outside the blood vessels. So that's why blood stasis can cause bleeding. So that's still chronic problem, long-term disorder, or maybe coming from other patterns. So they cause the bleeding, yeah, dark color, usually. And they coming and disappear is pretty slow. Still can cause the big menstruations. Generally, it's dark color and have blood clots inside. So sometimes they may form the lumps, swollen lumps, basically on the side of the rib cage there. So you still can think about possible big spleen. And the face is black color, dark black color, and the possible have low fever and dry, but don't like to drink. Kind of some deficiency inside here. Blood blocking there and couldn't nourishing cause dry, but blood blocking there may be caused by some deficiency disorder. So that patient don't like to drink. Blood kind of stool, still coming from bleeding. And the pupil tongue, that's blood stasis. And the also have some like a dark red spot on it. Thin and choppy pulse. So that deficiency cause the blood stasis and the blood not moving. The choppy pulse is blood stasis kind of pulse. So this pattern can development from other patterns, pretty chronic process, and is more severe kind of pattern compared with other patterns. So treatment principle, cooling blood and moving blood without blood stasis and stop bleeding. So these conditions we use 血府足鱼汤. We're talking about this formula before. It's originally coming from 桃红素汤. Tao Hong Su Tang is the formula. Moving blood without blood stasis formula. And then go to different parts of the body with development for other formulas. So 血府足鱼汤, 府 internal organs, 足鱼 remove blood stasis. So that's basically working for internal organs, blood stasis conditions. So we still have 桃仁红花 here. 当归赤芍 川芎 So that's coming from 四物汤 and 抻筋熟地都生地 here. So that's basically 桃红四物汤 plus more herbs moving tea. 柴胡治咳 moving tea. And then we even can add in more herbs. 郁金 soothing the liver, moving tea, still moving tea. 丹皮 cooling the blood. 酱香 still moving tea. 甘草 100 formula. So that's 血府足鱼汤党参系统的法. So that's using for this pattern. For acupuncture, we still go to bladder 17 and spleen 10. Cooling blood, remove blood stasis. And spleen 6, 3 meridian tonified. And kidney 1. So that's mainly for this pattern, moving blood stasis and stop bleeding. So this page basically the same. So multiplications for different kind of conditions, that's the same. Then we're talking about the pattern. Spleen and kidney yang deficiency pattern. Our body's yang qi relationship with spleen and kidney. So they may come in together. They may separate them. We're talking here together, make it easier. But clinically, maybe more spleen yang qi deficiency, maybe more kidney yang qi deficiency. It's totally depending. So, yang qi deficiency. Patient have cold sense, chill. Relationship with kidney yang qi deficiency. That's usually like lower back and the legs, some soreness and cold. And linking with spleen yang qi deficiency, like people poor appetite, losing stool, still cold. And when we're talking about the pattern, this illness is the bleeding problem. But for this pattern, it's not that like other pattern is big bleeding. They still have some bleeding, but mainly is difference. Difference is more severe compared with the bleeding. The tongue is pale color, and the pulse is very, very weak. So that's basically for spleen and yin-yang difference pattern. This pattern will mainly need warming. Warming spleen and yin-yang. And also nourishing blood stop bleeding. We say compare with the other pattern, it's not a lot of big bleeding, but they still have bleeding symptoms and signs. So basically, we use two formulas together. 桂附拔味汤 So that's basically we have yin-yang tonified. And 黄土汤 that's spleen-yang tonified. So we put these two formulas together, like both yin-yang and spleen-yang tonified. So 黄 is the color, yellow. Yeah, 黄 is the color, yellow. 土 is the earth. So from the name, you can know that formula mainly tonified the spleen. So that's basically for this formula here, for this formula. Spleen-yang and yin-yang tonified. So in kidney tonified, we still have basic 肾气丸 idea in there. 肾气丸 idea. And 生力 肾气丸 idea. Modified from 肾气丸. So acupuncture, we still mainly use stop bleeding points, bladder 17 and bladder 20, but we can add in more points for the spleen tonify and the kidney tonify, even bladder 20 here, and the kidney 1. So these pattern truly we can use Maxa. So Maxa we can go to like Ren 3, Ren 4, even Ren 8. Also by 2 points we can Maxa. Bladder 20 and bladder 23. Especially do 4. Do 4 is pretty good points Maxa for tonify Yang Ji. And the modifications, yeah, for different kind of conditions, you can pick up different points to needle. So that's with the yin-yang difference. We're adding to 4 here, but truly you can mark on these points. When we're talking about pattern, liver failure. So this pattern is kind of excessive failure in there. They cause more fast red kind of bleeding. And big amount may coming from the nose, may coming from the gums, and generally red face and eyes. And the people pretty easily angry. Dry mouth with bitter taste and constipation. Big amount menstruation. So that's generally say most case is acute condition. But if truly maybe some people have chronic condition and then all the bleeding become more severe. So that's basically the pattern. Treatment principle: clear heat from the liver and still cooling blood, stop bleeding. The formula we use 温清饮加碘 modified. So we still mainly cooling blood and moving qi. So that's 生力 still cooling blood, 白芍 nursing blood, 白茅根 stop bleeding, 当归 blood nursing, 赤芍 nursing blood, cooling blood, 枴雄 moving blood. So that's 生地、赤芍、当归、枴雄 together. Still ideal 四物汤。And 栀子 clear internal heat from 3 焦。黄芩 clear heat, mainly upper 焦 and middle 焦。黄柏 clear heat, lower 焦。So put together, still 3 焦。栀子 clear heat from 3 焦。So that's pretty stronger clear heat formula. 木香 moving qi, 龙胆草 clear heat from the liver, and 大黄 purging fair. 黄连 still clear heat from upper jiao, middle jiao mainly, and stronger. So that's pretty stronger clear heat formula. And stop bleeding, cooling blood. Acupuncture. Acupuncture basically, we still can go to bladder 17. It's liver issue, we go to back of the liver. And spleen 6 still working for 3 jiao. Spleen 10 still stop bleeding, and kidney 1 inertia. Still pretty similar here. You can add in more like liver 2, liver 3, cooling for the liver, or even gallbladder 34, gallbladder 43. And the modification part, nothing special here. Nothing special here. Yeah, so they say for liver failure, can add in liver 2 here. So that's for this illness. Yeah, that's for this illness. So basically, for the chronic ITP, yeah, chronic ITP. So that's basically relationship, some qi stagnation relationship with the liver. So that's maybe coming from long-term disorders. We need to pay attention for liver issue if they have some liver stagnation. And also in some people, some other disorders like HIV, like people have another autoimmune system disorder, SLE. So that still belong to another autoimmune disorder. That kind of condition may be something relationship with their original illness, or maybe relationship with the drugs they use. So that's we also need to pay attention. And certainly we have another kind of illness still belong to purpura. We are not special talking about here. That's we name TTP. TTP. So that kind of purpura mainly is kind of relationship with acute kidney failure. So we need to see like what's truly reason in there, and then we treat the problems. So basically, chronic ITP may be the mixed pattern, even we separate talking about here, but it's a pretty possible mixed pattern, like Qi deficiency and yin deficiency, and maybe some deficiency heat rushing up, and also maybe with some blood stasis. So that's pretty commonly the pattern mixed together, and also maybe with liver stagnation. So we need pretty clear to look in the pattern and give patient the suitable treatment.